This webinar is actually brought to you by Dalfran Pharmaceuticals, and we thank them for their support during this Reproductive Health Month. So I'm going to introduce Professor Kruger to you. We're very honored to have him on our webinar this evening because he is world-renowned in the field of infertility. I'm going to go through a couple of his accolades now. Professor Kruger is the founder of the first IVF clinic in South Africa, and is also the proud co-founder and partner of Aevitas Fertility Clinic, which is in the beautiful city of Cape Town. Professor Kruger acted as leader of the team at Tygerberg Fertility Clinic, which led to the first test tube baby in South Africa in 1984, the first frozen embryo pregnancy in South Africa in 1988, and the first baby born from ICSI in South Africa in 1995. From a personal and clinical perspective, Professor Kruger believes in a holistic approach towards infertility and always tries to assist his patients by solving problems in the simplest and most cost-effective way possible. Professor Kruger is world-renowned in the field of infertility, especially male infertility, and we are so honored to have him here today with us. So over to you, Professor. Thank you for joining us.
Thank you. I really appreciate the invitation. Feel honored, and I will, because we've lost a little bit of time, start immediately. I've changed the topic a little bit, but it's still the same, but focus on medication and improvement of sperm quality. Question, what can you personally do? I wanted to share with you, is that those sperm clear?
Yes, yes, they are. Yes.
You will see that they are cigar-like, they are elongated, and these sperm, just for the audience to understand, to get a picture, if someone smokes heavily, for example, or smoke marijuana, or drink a lot, the sperm will look like that. But if you are in good health and good lifestyle, you will see a very big difference, especially there at the end. You see an acorn type sperm with a nice head, and we call the dark area post-acrosome and acrosomal area with a nice tail. These sperm are very healthy and very fertile. I take you back, you see that. So this is what we're going to talk about, to say, can we improve quality of sperm by doing certain things? And we're going to talk about lifestyle. I'm going to talk about medical treatment for certain male conditions. We're going to talk about vasectomy reversal, which I thought can be of interest, and varicocele. We say in Afrikaans spat aar, varicocele repair, and then conclude with one slide. So I'm just going to try now and just see if I can get it bigger. No. All right. So here you can see that the principles of treatment is to see the male and female together, to realize that the fertility of the female, if you up that fertility, she can compensate for a male factor and fall pregnant. So one must never see the male separate and make statements like you can never impregnate your wife, your count is very low. Always be positive, always try, but make sure that the fertility on the female side is good. And often there's a need for psychological support. So when we do a semen analysis, that's where we usually start. We want a reliable report to make a diagnosis. And here you can see azoospermia, meaning no sperm, or 2 million per milliliter is called oligozoospermia, or low count. And motility below 30% means low movement or low motility. Principle, the rule is, if there's an abnormal sperm, don't go on one analysis, repeat the semen, and then if that is still the same, low count, no sperm, low movement, then you need special tests. Just sharing with you, if there's no sperm, we will usually do the male hormones, which is FSH, testosterone. There are other hormones. Sometimes we must do prolactin and so on. That is for your doctor to decide. Often chromosomes must be done because you must try to understand why there is a no or zero count. And then conditions like cystic fibrosis must be excluded. All those things your doctor will be able to do. And with the blood test on cystic fibrosis, chromosomes, FSH, we can make a reasonable diagnosis. So if you, for example, see that the sperm is still zero, blood test FSH is, for example, normal, chromosomes normal, the patient will qualify for a testis biopsy, and you must do the biopsy in a facility where they can freeze the sperm. You don't go to a general urologist and then later on try to freeze. You do all in one. And most fertility clinics, of course, all of them will be able to offer that testis biopsy with freezing. Then if the count is low, you will also do FSH, testosterone, chromosomes, and cystic fibrosis not applicable here because usually they always do not have sperm because the cystic fibrosis patients have a lung condition, and then the VAS coming from testis to outside world is not there, and that is why they don't have sperm. But you will always find sperm in the testis in the cystic fibrosis patient. So if the count is low, the FSH is normal, the doctor will know that that man can get medical treatment, something like Fertumet, also supplements that we'll talk about later, that can assist in the quality of sperm. And the low motility patient also can benefit from the drug called Clomid or Fertumet. I'm going to stop here for a second because I know it's a mouthful. Can we ask if there are any burning questions now and I can handle it while it's still in your head, and then we move to lifestyle?
There is a question, Professor
Yes.
Kruger. The question is, I've been on TRT for 8 years. I was originally placed on it because of a low T count.
What is are you talking about testosterone replacement therapy?
That's what I think, yes. I actually think, so he goes on to say, I actually think I could have recovered my testosterone count with a better lifestyle and without going on the therapy, but hindsight is 2020. I've chosen to go off of it in hopes that my sperm count will recover and that I become fertile by some miracle. Is it essential to take Clomid and HCG for this process to happen?
If there's no sperm after 3 months of being off, the correct thing is to stop the testosterone. I will talk about it later. And if there's no sperm, one can definitely try clomiphene citrate, dose 25 milligrams a day, 5 days a week. And if that doesn't give any result after 3 months, one will also watch the FSH, see that it goes up. Then one can give gonadotropins, which I'll talk about in a second. Good, thank you for that question. We'll come back to that. Anything else?
There is a question about the role of genetics in male infertility.
Yeah, that's applicable especially to azoospermia, and we always need a chromosome analysis, and also there are certain deletions on the Y chromosome that can also be tested for. But the broad semen analysis with chromosomes must be done.
Okay. And
for example, there are conditions like Klinefelter syndrome or deletions on the sperm that can explain the problem.
Okay. Thank you.
All right,
Those
so
are the
I'm
two
going
questions.
to lifestyle now. Just a few words, but very important. I don't know why I've chosen this ugly marabou stalk, but let's say you must force yourself to follow good lifestyle, and then perhaps it will benefit you. So if someone is overweight, it doesn't say you can't fall pregnant, but according to the literature, and I've got references there, if the body mass index, that's height and weight calculation, is above 25, especially above 30, there's a reduction in fertility, and a little bit of weight loss sometimes can bring more regular cycles, and if the male is fine, it can bring the pregnancy. It's also well known that if the BMI is high, the IVF outcomes, and of course also the chance at home, is lower. So eat correctly, that's the bottom line, and get help. Don't hesitate to see a dietitian. Then caffeine and alcohol. So there's a decrease in IVF pregnancies in coffee drinkers, but also at home. And the time to pregnancy, if there someone takes more than 6 cups per day, there are patients like that, or when the male consumes more than 20 alcohol units per week, impact on fertility from both sides. Just want to say that we also know that if someone is pregnant and taking a lot of caffeine, it can even cause intrauterine death. So coffee can be taken. The rule is 2 per day. 2 good coffees per day is enough. Smokers, you all know it, marijuana, dacha, impact on fertility, and the ovary can age, and there's less production of hormones from the ovary side, and the quality of oocytes will be definitely affected. So I always tell the patients, if you're 30 and you are smoking, you're coming to me actually at age 40. If you stop, your fertility will, luckily, you can turn it around, and within 6 months, 3 months, the fertility is equal to your age 30 again. But smoking is a big culprit in outcome. There are impact of the smoking on age. I've just given the example. And then on sperm, you get abnormal DNA, and that affects the quality of embryo, abnormal embryo, and they don't implant. So both partners, obvious, should be counseled to stop smoking, alcohol, marijuana prior to trying to fall pregnant, not necessary for ART. ART is assisted reproduction, but I always think about home. And as I've said there, the pregnancy chance at home will also be much better. So I'm at a break again. So is there anyone perhaps with a burning question now before I go to the next section?
There's a question about stress, Professor Kruger.
Yes, good question. Thank you.
How does stress affect?
Yeah, it affects fertility. On my desk, I always have the brain, and the brain will definitely just illustrate to the patient that we mustn't underestimate stress. What can we do? Mild exercise, if necessary, see a psychologist, because it's sometimes a very tough journey. And then I ask the patients to write notes, call it morning pages. every day. You write what you feel, what you experience, and then always end with a positive little note. You can just use words, but express yourself. And that, and exercise, and then if necessary, see a psychologist. And sometimes you need an antidepressant or anxiolytic tablet. And there are tablets that is safe in pregnancy or before pregnancy. Other questions?
What can be done to boost sperm count naturally, if there's anything?
Oh, lifestyle, number one. Number two, I will come to it, but supplement, for example, vitamin C, folic acid, and zinc. Dose of zinc 40 milligrams a day, folic acid 5 milligrams a day, vitamin C 300 milligrams a day, which is an antioxidant, can naturally perhaps improve. I say perhaps because they're not solid studies, but they are circumstantial evidence saying it is worth your while. There are many products on the shelves. Don't use everything that you can see, but those three, that's also in the Sperm Proof tablet, can help you to improve your quality.
Thank you, Professor Kruger. And what is a healthy sperm count?
Yeah, so if the count is above 14 million per milliliter, you can write it down. If the motility is above 30%, if the forward progression is above 2+, that's a technical thing. If the morphology, the shape of the sperm, I've showed you the beautiful sperm and the ugly sperm early in the lecture. If you get those acorn type sperm and you have 5, 6, 7, 8, 9, 14% normal forms, that is a normal semen analysis. But it's for your doctor to discuss it with you, and you can have a normal analysis, perfectly normal, 200 million sperm per milliliter, but you're smoking, and then you affect the quality, and the DNA fragmentation will be there. And then, although the count is good and the doctor says you're looking super, you're not super because of lifestyle.
Yeah, okay, that makes sense. That's
All
it
right.
for now. Yeah.
So we go to specific treatments. If there's a azoospermia or severe low count, and there's a very, very low FSH and LH and testosterone, there are different reasons for that. So I'm giving you a few. You can be born, a male can be born with a low FSH and LH. We call it hypogonadotropic hypogonadism or hypo-hypo. You can sometimes have a tumor in the brain. Adenoma is a very friendly tumor, and one can treat that. We'll talk about that. Sometimes just for unexplained reasons, very high prolactin, or you have a adenoma, and indirectly that will affect the sperm count because it affects the FSH and LH from the brain. And then very common, these young men looking like a Springbok rugby player, due to misuse of anabolic steroids, testosterone in gyms, will take your sperm count to 0. And it's sometimes difficult to get it back. So if you're aware of misuse of this drug, stop and test yourself after 3 months and get help from a knowledgeable person. So I'm going to the next, the specific condition. If there is this hormone called prolactin, and the prolactin is very high, it can often be as a result of adenoma. It is a little tumor in the midbrain, in the pituitary gland, and that will decrease semen parameters. If you treat the prolactin and bring it down medically and make sure that the adenoma is shrinking, which can often be the case with those two drugs, carbapenem or bromocriptine, and they can suppress the prolactin, that's hyperprolactinemia, and then the sperm count will come back to normal. Then we've talked about the anabolic steroids. The short answer is stop. No testosterone. Make sure if you take a supplement that you read what is in there, and sometimes men do not even realize that they are taking some other anabolic steroid in the gym. The semen can return to normal. I usually look after 3 months. If there's no change, if the hormones is still suppressed, I will start with clomiphene citrate. And if after 3 months there's still no improvement, we must start with injections. I'm just showing you the list again, some of these conditions, and we start with the injections of FSH and LH. So what is suppressed in the brain, we give then to the male in the form of, for example, Menopur, Gonal F, Orbitrol. There are many on the market, and there are specific doses. So I just want to quickly tell a story here. Example, there's a young man that was sent to me via his physician due to the fact that he had a midbrain tumor that had to be operated on, and then there was damage to his pituitary gland, not because of anyone's fault, but because of the massive tumor. It was successfully removed. It was benign, and then he was asking, he's 18, 19, that we treat him. He wants to freeze sperm, and after 3-4 months on the FSH LH injections, he started producing sperm. 6 months, quality was good. We started freezing, and we frozen enough for him for future help. This man cannot stay on these drugs. They're expensive, and he will benefit from testosterone because that's the only way to keep him going. But the sperm will be in the freezer for future use. Infections, as part of the basic semen analysis, one must always look for infections and treat if there's anything. Often it is not a dangerous infection, but if it's in the prostate or in the semen, must be treated with an antibiotic. Antibodies, that's part of the semen analysis. If you get that, make sure about the ovulation, about the mucus of the female when she ovulates. In spite of antibodies, they can still impregnate their wives, but if it doesn't work, then we wash the sperm and we do IUI. That's insemination. And if that doesn't work, then they qualify for IVF ICSI, where we inject the sperm directly into the egg. I've told you about the supplements that one can not do any harm using it to get good quality or to improve the quality of sperm. But as I've said, it is empirical, but not dangerous, no harm. Okay, let's stop there and hear if there are any questions around those few examples that I've showed you that one can treat the male.
There's just a question about, I think you probably get to this, but is there any point in doing IUI with low sperm count, or should they go direct to ICSI?
Yeah, difficult one. If there's enough sperm, that means above 500,000, some say 1 million moving sperm after wash, then you can do IUIs. About 40% of people will be pregnant after 4 inseminations. If not pregnant, then you go to ICSI. That's just a broad yardstick, but cases can differ, but I hope that will help.
Thank you.
All right, now we're talking about reversal of vasectomy. I just thought that I must share this important information. It's not new, but many urologists are still trained that if there's 11, 12, 13 years after vasectomy, you can't reverse, results are not good. That is not true. With this article of Fuchs, 173 men, pregnancy rates 15 to 19 years after the vasectomy, the sterilization was 49%, and 20, 25 years, 39. Now, I don't know, how old those wives were, the second wife usually, but here is some interesting data on age. So if the wife is less than 30, very good results after successful reversal. So it must be considered by a urologist trained to do the reversal. That's very important, that you make sure that it's not the general urologist, it is very super specialized. So there are people, I think, in each city, and you can easily find out who they are. But just look at the age 30 or younger and 36 to 40, a clear drop in pregnancy rate, which is normal. We expect it, but there's still a pretty good chance if you have the time. All depends on the age of the male. But I just wanted to share that principle with you, because there's this misconception actually all over the world that if you pass 10 years of reversal, then don't do it. If the female, however, is in the region of 40, 38, we don't reverse. I usually say go straight to ICSI then, IVF. Any question there?
No, none for that section.
All right, so a last, are we still okay with time? I'm almost done.
Yeah, that's fine.
The varicocele, we say in Afrikaans spat R, varicocele around the testes. Usually it is on the left side, 10 times more common. Make sure that you examined by your doctor or ask him to exclude the varicocele. It can affect sperm quality. And if you remove that palpable, hear my words, palpable varicocele, it will improve the semen quality. It's not, if they pick it up with ultrasound high up, there's no proof that you must get a varicocelectomy in those cases. It's only the palpable ones, and you can get big benefit by correcting it. So I'm at the end. I've just took samples of male fertility conditions that are treatable, but I think my main message, because I see that every day, lifestyle, important, smoking, marijuana, other drugs, the gym, and also alcohol. Broad principle, a male must not take more than 4 drinks at a given time. They define that as binge drinking after that. So be aware and be as healthy as you can. And then the broad principle is, even the fact that there can be a male factor doesn't mean you can't impregnate your wife, but she must also be evaluated, because sometimes there are subfertility on her side, and that must be corrected, and then your chances will be much better to succeed. Thank you. Thank you for the invitation. Sorry for the little bit of delay, but I hope we covered what you wanted us to cover.
Thank you, Professor Kruger. There is a question about vario, because that one. It's vario. How do you pronounce it?
Varicocele, the varicocele. Spat R
varicocele.
is easier in Afrikaans.
Yeah, it is. How
Yeah.
does that affect fertility, specifically regards to the later stages 2 and 3? Also, once a varicocelectomy has happened, what can be done to help with fertility?
Yeah, so it's a mouthful there. So the temperature around the testis will increase, and that is apparently one of the reasons for the testis is hanging outside the body because the testis likes a little bit lower temperature. Varicocele will heat up the testis, and that's why it's been clearly shown that if you correct the varicocele, that the quality of sperm will improve, count will improve, and the sperm will be much happier, if we can put it that way. There was, what was the other question around that varicocele?
Also, once a varicocelectomy has happened, what can be done to help with fertility?
Yeah, that already helps. And then you must look at the female to make sure she's 100%, she's ovulating, she's got regular cycles, her weight is fine, her lifestyle is good. And then perhaps these supplements, you don't need anything else than what I've already referred to, and that can also help quality.
Okay, and do you think, one last question from me, Professor Kruger, do you think that male infertility is becoming more prevalent? Are you seeing more cases than you over the past 10 years, say, more cases now than before?
Just on a lighter note, since we've won the Rugby World Cup, everybody wants to look like Peter Steph the Tour and a few other guys, so they go to the gym and then they don't manage, and then they go to the testosterone supplements. But no, I don't know if it's more common. I think lifestyle stress is definitely playing a role. But there's studies in Scandinavia saying that it's more common. We looked at it a number of years ago at Tygerberg Hospital, but we couldn't see a change in semen parameters over 20 years. So unsure, but the principles I've outlined, and if you follow that, your fertility will be the best it can be.
That's a perfect note to end on. Thank you, Professor Kruger. I see it's still daylight in Cape Town. It's pitch dark in Joburg. It's already dark.
Just want to say again, thanks so much for the invite. And did we cover all the questions?
Yes, all the questions are covered. Thank you. Thank you for your time this evening.
I can go and watch the news.
You can.
Yeah, thank you.
See the budget.
Thank you very much. Have a good evening. Appreciate the invitation again. Bye.
Thank you. If you keep an eye on reproductivehealthmonth.com, those videos will be loaded of each of the webinars that we've had over the course of Reproductive Health Month. Thanks so much to Dalfran. Take a look at their website. They've got some amazing products. Have a good evening, everyone.